5.5 months, we decided to try oatmeal because oatmeal is a safe baby food. And so we mixed it with breast milk and we started feeding him and he was loving it. And then that night we put him down and he woke up just throwing up continuously. It was like he had food poisoning. So we ended up taking him to the ER, and it was not a pediatric ER, which we realized later on was a mistake. But they just told me first that he was spitting up. But his stomach was convulsing and he was definitely throwing up. It was definitely an alarming experience.
Welcome to Eat Your Greens with Dr. Black, where we discuss plant-based nutrition for the whole family. This podcast is all about supporting families in their efforts to give their children a solid foundation of healthy eating habits that will last a lifetime. I'm your host, Dr. Angela Black. I'm a board-certified pediatrician with over 20 years of experience. Over the course of my career, I've witnessed the rise of issues like high blood pressure, type 2 diabetes, and even fatty liver disease in kids as young as 10. I'm passionate about using evidence-based guidelines to teach my patients and their parents how to prevent chronic diseases for a lifetime of health. I hope you find this podcast to be informative and empowering. For more episodes, or if you would like more information about child nutrition and feeding, please visit www.eatgreenswithdrblack.com. Welcome to episode 15 of Eat Your Greens with Dr. Black. In my last episode, I talked about the best way to introduce your baby to their first foods, and I mentioned some of the newer recommendations regarding foods commonly associated with allergies. Today, I'm taking a closer look at food allergies and food intolerance. If you're like many parents, you worry that your child will have a serious reaction to food, especially if other family members have a history of food allergy. Do you know what the symptoms of food allergy are? What about intolerance or sensitivity? What's the difference between these things anyway? As with many health issues where there's a high degree of uncertainty, the internet is rife with conflicting information, and there are plenty of people out there hoping to make bank by selling unproven tests or treatments. In this episode, I answer the most common questions about food allergy and intolerance. You also get to hear from a mom who agreed to share what it was like when her infant son developed an uncommon and severe reaction to the baby food she thought was supposed to be safe. Let's get into it. Please be aware that this podcast provides general health information about nutrition and feeding of infants and children and is meant for educational purposes only. It's not intended to replace the important relationship between a parent, child, and pediatrician. If you have concerns about your child's nutrition, health, or growth, please consult your doctor. Okay, here we go. I can't do a whole podcast episode about something if we don't all understand what I'm talking about. So, as usual, I will start with some definitions. Some common terms you may have come across include food allergy, food intolerance, and food sensitivity. A food allergy is an immune system response. It occurs when your body mistakenly identifies a certain food as harmful and, in its defense, triggers a cascade of reactions that include the release of various inflammatory molecules like histamine. This culminates in an allergic reaction, which can range from mild to severe. The reaction is reproducible, meaning it happens every time the offending food is eaten, and it's fast. It occurs within minutes to maybe a few hours of ingestion. Food intolerance, on the other hand, is a digestive system response. It happens when your body can't properly break down certain foods, often due to enzyme deficiencies. For example, lactose intolerance results from the insufficiency of an enzyme called lactase that breaks down lactose, the main sugar found in milk and dairy products. Food intolerance may occur many hours or even a day after eating the food, and it can be variable based on things like how much of the food was eaten. While both conditions can make you uncomfortable, a primary difference lies in their severity. An allergic reaction to foods can be life-threatening, while food intolerance is often less severe and mainly affects your quality of life. Food sensitivity, on the other hand, is a more nebulous phenomenon. The symptoms tend to be vague and aren't always reproducible. Reported symptoms of food sensitivity include things like fatigue, brain fog, difficulty concentrating, or just general malaise. Food sensitivities are not something that can be diagnosed with a lab test. As a result, you'll see them being diagnosed by practitioners in fields not supported by hard scientific evidence, the pseudoscience world. Usually, they do this to get you to buy whatever supplement or course of treatment they're selling. It's not that the issue doesn't exist, it's more that it's an individual experience that's difficult to diagnose or prove. To begin with, let's start with food allergy. There are two main types of cells in your blood, the red blood cells and the white blood cells. Red cells carry oxygen, and white cells are a part of the immune system. They make immunoglobulins. Immunoglobulins are small protein molecules that float around and monitor for invaders, and they help the immune system destroy them. There are 5 types of immunoglobulins called IgA, E, G, M, and D. Each of these is involved in a different immune system function. A type of white blood cell called a plasma cell makes IgE. Now, IgE is beneficial. It helps us fight off various parasitic infections, but it's also the main immunoglobulin involved in allergic reactions. What exactly is an allergic reaction? Well, I'm glad you asked. An allergic reaction is when the immune system has an abnormal response to a substance that is normally harmless. This reaction can be mild, like a runny nose when the pollen count is high, or life-threatening, like anaphylactic shock. For example, let's say you eat some peanuts for the very first time in your life. You've never had a peanut before, ever. For some reason, your immune system decides that peanut protein is a dangerous invader. Your plasma cells will make IgE. You don't have an allergic reaction that very first time because you didn't have any IgE yet. Your immune system has to have seen something previously in order to react to it effectively. On a side note, this is how vaccines work. If your immune system has never seen something like, say, the measles virus, it can't effectively react to it, and you become sick with the disease measles. A vaccine shows your immune system a protein from the measles virus so it can make antibodies, and then if you encounter the actual virus, your immune system can quickly mount an effective response to prevent the disease and keep you healthy. Okay, back to allergic reactions. So, you ate your peanuts for the first time, your plasma cells made IgE, but nothing else really happened. So the next time you eat peanuts, that anti-peanut IgE recognizes and binds to the peanut protein and then signals other white cells, things like mast cells and basophils, to release a bunch of inflammatory chemicals that cause the symptoms of the allergic reaction. This is called an immediate hypersensitivity reaction. It happens within minutes to up to maybe an hour of being exposed to the offending substance. The main inflammatory chemical that's released from the mast cells is good old histamine, which is why the main meds that we use during allergy season are antihistamines like Benadryl, Zyrtec, Claritin, etc. These block the effect of the histamine to prevent those symptoms that we're all familiar with: runny nose, itchy eyes, hives, etc. I'm recording this episode during cedar season here in Central Texas, and I'm sure that the stores are selling antihistamines like crazy right now. So when it comes to food allergies, basically, you can be allergic to any type of food, even foods that you've eaten many times throughout your life. For some reason, your immune system decides that shrimp you've always enjoyed is now a threat and makes anti-shrimp IgE. Having said that, most food allergies start in childhood, and 90% of allergies are due to just 9 different types of food. These include eggs, milk, peanuts, tree nuts, and tree nuts includes walnuts, almonds, pecans, things like that, soy, wheat, fish, shellfish, and sesame. The most common symptoms of a food allergy include tingling or itching in the mouth, hives, swelling of the face, including the lips, or sometimes swelling elsewhere in the body. There may also be wheezing, abdominal pain, diarrhea, and vomiting. In severe cases, anaphylaxis occurs. This is a severe allergic reaction that needs immediate medical attention. The symptoms of anaphylaxis include constriction of the airways that makes it hard to breathe, rapid heart rate, lightheadedness, shock with a severe drop in your blood pressure, loss of consciousness, and sometimes even death. This is why people with severe allergies need to carry an EpiPen. That's a device that injects a dose of epinephrine, which halts the progression of the anaphylaxis so that the paramedics have time to arrive and save your life. Approximately 50 million Americans have a food allergy, which is around 6% of the population. The statistics I came across varied some, but it's estimated that 8% of children may experience an allergic reaction to a food within the first 3 years of life. The rates of food allergy are rising, but the reasons for this trend are unclear. You may have a higher risk of food allergies if you have an allergic family member, but we don't know if this is genetics or epigenetics. Epigenetics is the effect of outside factors that can turn genes on or off. Some other things that may increase a child's risk of food allergies include having eczema, which is in itself an allergic disease. Also, exposure to air pollution or a low vitamin D level at 1 year of age. On the other hand, it's been noted that children raised near animals, children with older siblings, and children who attend daycare by 6 months of age may actually have lower rates of food allergy. And then, of course, there's the effect that your microbiome has on your immune system and how that affects the rates of all types of allergic disease, for better or worse. More studies definitely need to be done. People often outgrow allergies to eggs and dairy, but allergy to peanuts, tree nuts, and shellfish are usually lifelong, unfortunately. So, how do you know if your child is allergic to a particular food? How is it diagnosed? There are 2 commonly used tests. One is a blood test to measure the level of IgE against specific foods. And the other is a skin prick test, also called a scratch test. This is an indirect test of IgE. Basically, the allergist places a droplet containing the food protein on the skin and makes a scratch. If IgE to that food is present, it will stimulate the release of histamine from the mast cells in the skin, causing a welt to develop at the site of the scratch. The size of the skin reaction correlates with the level of IgE present. Now, it definitely has to be said that in order to diagnose a food allergy, you have to have an actual reaction to the food. We don't just order IgE panels on all children to screen for allergies for a few reasons. So let's look at a couple scenarios. So, for example, your kid breaks out in hives after eating a lunch consisting of an egg salad sandwich on wheat bread, apple slices dipped in peanut butter, and a glass of milk. So that's 4 of the most common allergens in just one meal. Your doctor will first recommend that you hold off on any of those foods until the test results are in. So let's go with an IgE test. The doctor will order the blood levels for IgE against each of those 4 possible offending agents. If the child has, say, IgE against peanuts, but not against any of the other foods, then a peanut allergy is diagnosed, an EpiPen is prescribed, and you're told that your child should not eat foods with peanuts. The other foods, like the eggs, wheat, and milk, can be safely offered. But what if it's not that straightforward? Let's say your child has eczema that sometimes flares up, or random hives without an obvious trigger, or maybe milder symptoms like stomach pain and diarrhea with no clear pattern. Keeping a food and symptom diary can be helpful in identifying which ingredients may be triggering reactions. The best practice would be to then do systematic single food elimination trials where you withhold an individual food for 1 to 2 weeks and then reintroduce it. If the symptoms improve during the elimination phase and then return with reintroduction, you've found the offending food, and IgE testing or scratch testing can be used for confirmation. The elimination process can be difficult, though, and it's time-consuming, so it's not uncommon for doctors to just order an IgE panel against a variety of foods. The question then becomes, how do you interpret the results? False positives are actually common because the immune system can be sensitized to something. Sensitized means it's making antibodies, but those antibodies don't actually trigger a reaction. Also, even if you're allergic to something, the level of IgE in your blood doesn't necessarily correlate with how severe of a reaction you're going to have. What ends up happening is that parents are told that their child has IgE against a number of potentially healthy foods, and then they restrict those foods, which leads to a lot of anxiety and a decreased quality of life for both the parent and the child. So you still have to do a food elimination and reintroduction trial to pair the test result with an actual reaction to the food. For milder reactions like eczema, this can be done by the parent at home with guidance from their primary care provider, but for more serious allergic reactions, the allergist may want to do an oral food challenge in their office. This must be done in a supported medical setting in case anaphylaxis occurs. Let's make it even more complicated. There's something called oral allergy syndrome. Oral allergy syndrome is not a food allergy, even though the symptoms occur after eating certain foods. This is actually a pollen allergy, and it's sometimes called pollen food syndrome. So the symptoms include itching or tingling of the lips and tongue with occasional swelling of the lips. It turns out that the proteins in some foods resemble those found in common pollens, and your immune system mistakes the food protein for the pollen protein. So for example, if you develop an itchy tongue every time you eat watermelon, other melons, or banana, but you don't have IgE against those foods, you may actually have a ragweed allergy. That's definitely relevant here in Central Texas. Birch tree pollen is another common one, and people will have reactions to a long list of things, including fruits like peaches, apple, pear, and kiwi, certain herbs like cilantro, fennel, parsley, even things like celery, carrots, and some nuts and legumes. So, to sum up, the most common type of food allergy is an immediate sensitivity immune reaction. It occurs within minutes to a couple hours every time a food is eaten. It's mediated by IgE, and the symptoms can be serious or even life-threatening. There is another type of immune reaction called a delayed hypersensitivity reaction. As you might guess from the name, it takes a little longer, even up to 24 hours, for this reaction to occur, making the diagnosis more difficult. A delayed hypersensitivity reaction is not mediated by IgE. Instead, other types of white blood cells like T cells, monocytes, and natural killer cells play a role. Delayed hypersensitivity reactions are why some people can't wear jewelry containing nickel, and it's responsible for the reaction to poison ivy. Unfortunately, there are no lab tests to confirm non-IgE-mediated food allergies. In babies, we see a couple different examples of delayed hypersensitivity reactions. The most common is a cow's milk protein intolerance. Starting at around 2 to 4 weeks of age, babies develop fussiness or colic and may have symptoms of reflux. Their stool may have visible blood in it, or it may turn a dark green color, which is due to broken down blood cells. For breastfed infants, the treatment is for mom to cut out all dairy from their diet because the cow milk protein can cross into breast milk. This is one of the few things in life that is actually all or none. Even small amounts of dairy in mom's diet can cause problems. As you can imagine, it's difficult to completely cut dairy out of your diet, and in some cases, the baby's not able to continue nursing. Formula-fed babies are put on a protein hydrolysate formula, where the cow milk protein is chopped up into small pieces, or in many cases, we have to go all the way to an amino acid-based formula, where the proteins are reduced all the way down to the individual amino acids. The good news is that most babies grow out of milk protein intolerance by around a year of age or so. There's another less common delayed hypersensitivity reaction that's seen in infants called FPIES. FPIES stands for Food Protein Intolerance Enterocolitis Syndrome, and it can be a serious problem resulting in poor feeding, irritability, vomiting, diarrhea, or bloody stools. Babies often end up in the emergency room needing IV fluid hydration, and the reaction may even be serious enough to warrant admission to the hospital. The most common food associated with FPIES is cow's milk, followed by soy and grains including wheat, rice, and oats. I had a little patient a few years back who developed FPIES, and his mom graciously agreed to be interviewed, so you get to hear firsthand about their experience. I'm really pleased to be sitting down today with Carli. She's a mom of two cute, rambunctious boys. She's a teacher and a really phenomenal person, and I've gotten to know her some over the years. I'm really happy to be able to take time to talk to you today about your experiences with FPIES, FPIES, right? Food, Protein Intolerance, Enterocolitis Syndrome. It's a lot. It's a mouthful.
Yeah.
So tell me a little bit about your son. He was born healthy, no issues at first, right?
Yeah. I mean, I tried to do everything right. I did natural birth, thought, I would have control over full health. Breastfed. He did have, some latch difficulty, and we had to get some work done on that, but he was still healthy. And then 4 weeks happened, and then the reflux set in, and that was an interesting experience. And then, so that's kind of when things started showing that he was going to have some sensitivities and everything like that. But at birth, everything was great.
So even as early as 1 month of age, and he's exclusively breastfed, he started having some digestive issues. He had reflux and was pretty bad, right?
Yeah, like I remember 4 weeks, he just kind of turned into a different baby, just very fussy, could not get comfortable, would always want to feed and then spit half of it up. And we actually got a lactation consultant, and she was saying that she believed he had reflux and everything. And then I started first with diet elimination just to see if I could help him with not doing dairy and just the common tomato reflux foods. And it was improving some, especially with dairy elimination, but not fully. He was still crying most of the day.
That's really hard when the baby's just crying and you feel so powerless, right?
Yes. Yeah. It was very discouraging, but luckily we have you as a doctor and you helped us through that. And we got him on what was the medicine? Do you remember?
I believe we started with what's called an H2 blocker. That's like Pepsid. I think at the time it may have been Zantac, which has since been recalled. We don't use that anymore.
Right.
But it didn't work. We had to switch him to the stronger one.
That was Nolan.
The PPI.
Nolan wasn't Nolan the P?
And then it was him also back. Because Mason in his chart, we had issues. Right. So we started with the H2 blocker, and then when I reviewed the chart, we switched to the stronger PPI acid blocker because he was having such severe reflux.
Right.
And I actually came across a statement that you made. You were feeling very stressed because even going out to eat, it was limiting your ability to just enjoy your life as a family because he was crying so much.
Yes, I remember seeing, this was my first baby, and I would go to HEB and I would see babies the same age being able to go into that store, and I knew Mason would not be able to not cry while in there, and I wouldn't be able to shop, and just realizing there was something off there.
So it was really limiting and affecting your quality of life.
Yes, definitely.
At what age did you start introducing solid foods?
So with the latch and everything, Mason was gaining weight, but he was still on the really lean side. So at 5.5 months, we decided to try oatmeal because oatmeal is a safe baby food. And so we mixed it with breast milk, and we started feeding him, and he was loving it. We gave him a bath, and then that night we put him down, and he woke up just throwing up continuously. He threw up 7 times and had 2 diarrhea diapers, and it was like he had food poisoning. And that week we had put him on some antibiotic for an ear infection. And so we were thinking he just had an allergy to the antibiotic. So we ended up taking him to the ER, and it was not a pediatric ER, which we realized later on was a mistake. But they just told me first that he was spitting up. But his stomach was convulsing, and he was definitely throwing up. And then they didn't really do anything for him. He was sleeping a lot. He seemed very lethargic to me. And then the next morning he woke up fine and ready to eat again and everything. But it was definitely an alarming experience. And we decided that he was allergic to the antibiotic after that. And then we didn't do food again until 6 months. And of course, not knowing, I did oatmeal again because that is a safe baby food. And the same thing happened. And so then my mom brain clicked, and I was like, okay, it's actually the oatmeal. It's not the antibiotic. And it alarmed me. I couldn't believe my baby was allergic to oatmeal. And then it was a very odd thing because, he also has an egg allergy. And that is a very traditional allergy where it happens right after, right? We gave him the egg, he throws it up, he breaks into hives. But this, it would be an hour after where there was a reaction. So it was harder to catch. But, he would throw up, and then he would get very lethargic and sleepy afterwards. And after talking to the correct allergist, that is very common. That is part of FPIES.
Right. Yeah. Some babies end up needing IV fluids. They get admitted to the hospital. It can be quite a serious reaction.
Yeah, it was alarming, especially his first one. I was worried about his liquid and everything. And I wondered if we had taken him to a pediatric ER, had they treated it a little differently.
Right. Who knows?
Yes.
Hindsight.
Yes.
So we did end up referring you to an allergist, you said, and they're the ones that started giving you more guidance. What other foods did he have difficulty tolerating?
Right. So we went to one who gave us the food groups of what was probably going to be kind of his problem. And so it was mainly grains. And so they told us to start off with rice and then barley. And we tried brown rice, and he couldn't sleep that night very well. So we knew it was hurting his stomach. And so honestly, we just decided with the food groups that we were just going to find what was good for his body until he could kind of tell us more, because you get into the battle of, is it teething or is it that his stomach hurts? And so we really kind of held off until he was 3 and was supposed to outgrow it, because we tried and it just kept backfiring. And he just was really miserable when we tried. Yeah, it just wasn't worth it.
And it's always a guessing game.
Yes.
What is he fussing about now? Then they can't tell you. Do food allergies run in your family? Anybody, or asthma, other kinds of allergies?
Yeah, so it's actually funny. I was looking at my baby book a couple months ago, and I have it recorded that I was allergic to rice cereal at 4 months old, but then my mom doesn't remember it. So I guess I was probably sensitive, but I don't think I had what Mason had necessarily. But I mean, Stefan, my husband, he has traditional allergies and would have to do the allergy test, but no really food allergies. Neither of us have anything that we have to avoid.
So what happened as he got older when you started introducing different foods after age 3, expanding the variety of foods in his diet? How has that gone? He's about 4 now, right?
Mm-hmm. Yeah.
So how's the last year been with trying new foods?
It's been so good. So, I remember first telling you about this and you telling me the data shows that about 3 years and it gets a lot better. And it is true. He can eat oatmeal now. He is on bread. It was kind of nice because a lot of my friends were struggling with their 3-year-olds with eating, and we got him on bread and he was like, eating's great, so it kind of helped us in that area. But it was a really easy transition with waiting till he was 3 because we haven't really had any kickback. There are certain oatmeals, like steel cut oatmeals he's fine with, but then if we do like old fashioned oatmeal, sometimes he'll break out in a little eczema. So it's still there's still something there, but it's going away more and more.
Does he still have egg allergy, or did he grow out of that too?
Yeah, he still has the egg allergy. So I think that one might be here to stay, but his mouth just gets itchy now. And so he's able to advocate for himself on that and everything.
Can he eat foods where the egg is cooked in?
It has to be very tiny amount. Like we've done a cupcake and one time it didn't affect him and then the next time it did. So I just think it has to be a very small amount of egg.
Have you ever heard of Just Egg? Do you know what that is?
Yes.
I love that product.
We just tried it last weekend. We didn't even know about it. So, yeah.
So for people listening who don't know what Just Egg is, it's a vegan product. Don't know why they named it Just Egg, because there's just no egg at all. And it's made with mung beans. And you pour it and it looks like a scrambled egg mix, and you can use it just like I saw online somebody making French toast with it. And I thought, okay, that's the next thing I'm going to use it. So I really enjoy it. But anyways,
yeah,
I really like Just Egg. So.
And I like Just Egg too, because it still has like the protein in it. And that's one thing with supplementing so many foods. I found that just because it's vegan cheese doesn't mean it's healthier. So like finding like a cashew vegan cheese or, and still having health in there versus just empty calories is kind of been an interesting battle.
Right. And less saturated fat, because most of the vegan cheeses are made with coconut oil, and that's saturated fat, which is still bad for your heart. Doesn't matter if it's plant-based or animal-based saturated fat. But the Just Egg doesn't have any fat because it's, maybe they add some oil. I'll have to look again. But it doesn't have saturated fat, which I also like.
Yeah.
What about other allergies? So he still has some eczema. Does he tend to react to the cedar or the ragweed, things, all of our Central Texas allergies that we have?
Yeah, he'll still get random rashes that we fight and everything, but it doesn't feel like a big deal anymore. We just put lotion on him and he's happy.
Great. Easier to manage.
Yes.
How many specialists did you end up taking him to? And did you feel supported by the medical community? And I include myself in that question because I want to know in the future, if I have a family with a baby with FPIES, what could I do differently? Or how can the medical community have supported you better in your journey?
Yeah. So with Mason, I've gone to 2 specialists. And then with Nolan, I've gone to 3. And I feel like you personally dealt very well. You told me who to go to. It wasn't just like, just find someone, but you told me what specialist to go to. And him being a terrible car rider, I tried a different specialist before, and they were not pediatric. So we ended up not having a lot of information. And so that's one thing looking back is always to stick with the pediatric. But the thing that I have found so helpful from specialists is whenever they take my list of observations and they want to hear my observations and they want to know what is going on, and then they base what their solution is off of my observations. And so the specialist you suggested did that. You always take my list and do that. And then I've actually switched a specialist with Nolan because I could tell my questions and observations were extremely annoying because it was a lot. But as the mom, you're with them all the time and you're getting all this data, and it's really frustrating when you can't do anything with the data just because not having the knowledge. And so I just really appreciated. I felt like I just have you and then a lot of specialists who just want to educate me in it. And that was just really awesome. And there is some specialists out there who don't want to do that. And so just my suggestion would be to switch specialists and find the right match of someone who wants to educate and wants all your data points.
I thank you for that comment. I agree. From my personal experience with my youngest, who's a special needs child with a rare genetic syndrome. So we saw lots of specialists all around the country, and definitely having people who know that you as the parent are the expert in your child. They may be the expert on the subject of fill in the blank disorder, but every child is different and the experience is different. And being able to respect and listen to the parents is so valuable. I definitely learned that. I think that's one way that Sarah made me a better doctor because, I had that experience with the specialist too. And I know what my kid is doing. Please listen to me. Yeah. So excellent point. Thank you for adding that. Yeah. What do you want other parents to know that are maybe having a baby who has, and just to go back and clarify, Nolan, your youngest son, did not have FPIES, but he had severe reflux and lots of difficulties with that.
Yeah. So he had reflux where, he went to the refusal to eat, but he was a chunky baby, so it was kind of confusing. And then he also has had the asthma, so we've in tons of food sensitivities, and his stomach's getting stronger, but we've had to build up his gut and everything. So he hasn't been easy either, but just figuring out kind of what he needs has worked.
They're all different.
Yes.
You think you know from the first one and you think you're prepared, and then the second one is completely different.
I know. And I just, tried, I was like, okay, the first one, all right, now this one, I'm going to really go all natural and just really watch it. And it just showed me I had no control, and that's okay because we learned some great things from it.
What message would you send to other parents if they're going through this with a baby who has, severe colic, feeding issues, food intolerances? What would you want them to know?
Yeah. So first, you will find things that your baby will be able to eat. It's hard because you're so excited that your baby's about to start eating, and then you're faced with this, and it can kind of be paralyzing at times. What do I feed my baby next? And I just suggest you go back If it's just sweet potatoes for a while, that's okay. We did sweet potatoes a long time with Nolan, and now he's on so many different foods. And so just really take time and don't get discouraged with what foods. Just really look at what foods are reacting right to your baby's tummy and just stick with those. It's okay if they're not getting a huge variety right at first. You will get there. And then another thing is it's a great time to really look at what is in food and seeing what all processed food has in it. It's actually changed our whole family's eating, and for the better. I try to get as few ingredients as possible in things, and it just kind of shows what is in things. And then also just to find a doctor who will listen to all of your crazy observations and make decisions based off of those. And then the last thing, there are benefits. When toddlers start getting picky, Mason was really stoked about getting to eat bread. So there is a bright side. And then another benefit is Mason, it's really opened Mason's eyes to what he can and can't eat. And he's always asking the question of, does this make my stomach feel good? Does this not make my stomach feel good? And then like with his egg allergy, he already advocates. When he was going to Mother's Day out, he would tell his teachers, oh, does that have egg in it? That's okay. I don't want it. And so there's some strengths in that. When Mason first had FPIES, I thought it would change his life, and it really did not change his life at all. He's a thriving, energetic, crazy 4-year-old. And so he's doing really good. And so just knowing that there's some bright sides and just buckling down and really seeing what's in food and what feels best for your baby's tummy.
Thank you so much for joining me. I really appreciate you sharing your experiences. I look forward to seeing y'all in the office, but hopefully not too soon. Everybody stay healthy.
Yes.
Okay, let's move on from food allergy to food intolerance and sensitivity. A food intolerance is an inability to digest a food or group of foods, frequently due to a lack or deficiency of the enzyme needed to break a component of that food down. Food intolerance may affect up to 20% of the population, and the most common symptoms are related to the gut. We're talking about abdominal pain, bloating, gas, or, as we call it in our house, Heine burps. I think I told that story in a previous episode. Also, you may have reflux and either constipation or diarrhea. Unlike allergic reactions, the symptoms can occur even days after eating the food, and they may be variable based on factors like how much of the food was ingested or other factors like gut motility. Going back to the example of lactose intolerance, some people can make low levels of the enzyme lactase and therefore can tolerate some dairy, but they may have symptoms if they overdo it. Fermented dairy like yogurt and kefir may be tolerated by people who can't drink milk, so the way the food is processed also has an effect on intolerance. Lactose intolerance is treated mostly by avoiding dairy, but also people can take a lactase supplement. On the other hand, food sensitivities are less well defined than intolerance, but they both tend to share similar symptoms. A number of substances found in foods have been implicated in food sensitivity, including gluten, histamine, salicylates, glutamate, various food additives, and FODMAPs. Don't ask me what FODMAP stands for. I have to look it up every time. Basically, FODMAPs are fermentable short-chain carbohydrate molecules that are found in certain fruits, legumes, grains, and dairy. The evidence on whether any of these substances causes actual disease is quite inconsistent across studies, which makes proper diagnosis and treatment difficult. For this episode, I'm only going to talk about two of these, gluten and FODMAPs. The most robust evidence we have relates to FODMAP-containing foods, in particular their impact on irritable bowel syndrome and SIBO, that's small intestinal bacterial overgrowth. There's good evidence that people with these disorders have fewer symptoms if they avoid FODMAPs. The list of high FODMAP foods is long, and it includes everything from milk and ice cream to beans, lentils, apples, pears, peaches, wheat products like cereal and bread, and even various vegetables like asparagus and onions. You'll notice that many of those foods are healthy. So a low FODMAP diet is very restrictive, and it not only affects your quality of life, but it can also result in nutritional deficiencies. It's meant to be a short-term diet done under close supervision by a qualified physician or registered dietitian with gradual reintroduction of the foods over time. It's also worth pointing out that gas and bloating are normal reactions to high-fiber foods, especially if you're not used to eating them. Here's an amazing fact. Humans only make a small percentage of the enzymes needed to digest fiber. The bacteria in our gut are actually the ones digesting the fiber. They make thousands of these enzymes, not us. If you've been eating a low-fiber standard American diet for most of your life and suddenly try to go whole hog, no, how about cold turkey? No, that's also not good. Whole rutabaga? I don't know. Anyways, if you suddenly try to transition to a plant-based diet, you may not have enough of the types of bacteria in your microbiome that are good at digesting fiber. People are led to believe that they have an intolerance to these foods that are actually very healthy and should be a part of their diet. So, go slow. Give your microbiome and your gut time to adapt before you jump to the conclusion that you have a food intolerance or sensitivity. So what about gluten? First off, I'm not talking about celiac disease here. That's an autoimmune disease characterized by a delayed hypersensitivity type immune reaction to gluten, and it can be diagnosed with blood tests and a small bowel biopsy. Non-celiac gluten sensitivity is characterized by the typical GI symptoms, but people also report fatigue, headaches, maybe difficulty concentrating, numbness in the extremities, and even joint or bone pain. There are no tests that can diagnose non-celiac gluten sensitivity, and the evidence supporting that this is a real disorder is mixed. Unlike FODMAPs, many of the foods containing gluten are unhealthy, pro-inflammatory, ultra-processed foods, so it's difficult to tease out what's really causing the symptoms. The bottom line here is, if you feel bad when you eat gluten-containing foods, then don't eat them, but be sure to replace them with healthy, whole plant-based foods. Things like French fries, milkshakes, and queso are all gluten-free, and they even now make a gluten-free Oreo cookie. So definitely not doing yourself any favors if you're cutting out gluten-containing ultra-processed foods and replacing them with gluten-free ultra-processed foods. When it comes to most forms of food sensitivity, there is a notable lack of well-designed, blinded, controlled studies. The wellness industry is well aware of this, and it's full of people touting tests and treatments that are not backed by science. A good example is the wide availability of IgG tests claiming to diagnose food allergies. Recall that food allergies are mediated by IgE. IgG is the most common antibody found in the blood, and its main job is to help the immune system fight off infection by things like bacteria and viruses. When your immune system is exposed to proteins from digested food, it might make IgG specific to that food, but that doesn't mean you're allergic to the food. In fact, higher levels of IgG to foods have been shown in some studies to protect against an allergic reaction. Once you have IgG against a food, you will have that antibody for life. Interestingly, when people grow out of allergies, say to things like eggs, the IgE level will decline and eventually disappear, but the IgG level may actually go up. So, don't be fooled by someone claiming that they can diagnose hidden food allergies with an IgG test. It's not only a waste of your money, but you're also wasting time and potentially delaying the diagnosis and treatment of the real cause of your symptoms. Many of the symptoms of food intolerance and sensitivity are actually due to dysbiosis. Remember from the microbiome episode that dysbiosis is an imbalance of the species of bacteria in the gut where the pro-inflammatory species outnumber the health-promoting short-chain fatty acid-producing species. This results in damage to the gut epithelium and leaky gut syndrome with its associated increase in inflammatory markers and allergic diseases and a higher risk of chronic diseases. Eating a diet full of fiber-rich whole plant foods has the potential to reduce inflammation, leading to more energy, less pain, and better overall well-being. Just remember to go slow when increasing your fiber intake and give your gut time to adjust. To summarize, food allergies are an immune response reaction mediated by IgE that occurs in the immediate period after eating the triggering food. It occurs every time you eat that food with the same or similar symptoms. Food intolerance occurs when you can't digest a certain component of food, such as lactose in milk, because you lack the necessary enzymes. The symptoms are primarily GI discomfort. They can occur hours or even days after eating the food and can vary based on a number of factors. Food sensitivity may involve inconsistent, non-specific symptoms and don't have a cause that can be diagnosed on test results. They may actually be due to dysbiosis or other disorders. If you're worried that your child may have a food allergy, FPIES, or a food intolerance, be sure to hold off on offering that food and talk to your doctor. Having to restrict common foods from the diet can be anxiety-provoking and it can affect the quality of life. So it's important to get an accurate diagnosis whenever possible. I hope you learned a lot from today's episode and are now empowered to take your diet and your health into your own hands. Thanks for listening to this episode of Eat Your Greens with Dr. Black. Parenting is a journey that comes with many challenges, but also much joy. I hope this podcast empowers you to set your family on the path to lifelong health. If you enjoyed this podcast, please hit the subscribe button so you never miss an episode. For more helpful information about plant-based nutrition for families and children, check out the show website, www.eatgreenswithdrblack.com. And don't forget to eat your greens.